Good afternoon, everyone.
Good afternoon, ma'am.
So today we are going to show the embryology models. So everybody can see this model.
Yes, ma'am.
Okay. So today we are going to show the model of the development of heart. So this is the model of the heart. If you are shown this, then you have to explain what are the structures present here. All right. So before starting the embryology, I want to recap a little bit. So how does the heart develop? First of all, cells from the epiblast migrate to the splanchnopleuric mesoderm. Okay, and then that splanchnopleuric mesoderm is a part of lateral pleuric mesoderm. From there, normally the heart is developed. There are two. First of all, there is two endothelial tubes. Okay, there are two endothelial tubes. They will fuse to form a single heart tube. So, can you see this model? Can you see this model?
Yes.
Okay.
Yes, ma'am.
So, first of all, there will be two tubes. They will fuse and they will form one tube. Okay, but the lower end, the caudal end, will be not fused properly. Okay, so this is the upper end, this is the cranial end, this is the lower end. So this is a heart tube. If you get this model, you have to say this is a fused heart tube. Then they will ask, what are these? What are these? Anybody can tell me what are these? You have studied now from Vishwajit sir's class. What are these in the heart tube? So when you start to say this part is the bulbus, okay, this part is the bulbus cordis, okay, and the down part we have the sinus venosus, bulbus cordis, sinus venosus, okay, then we have the primitive ventricle and primitive atrium. Is it clear, everyone?
Yes, ma'am.
So, if you get this model, you have to say this is a model of heart tube, fused heart tube. So, this upper part, this part is the bulbus cordis, this part is the primitive ventricle, this part is the primitive atrium, and this down part is the horn of the sinus venosus, horn of sinus venosus. So, this is very clear. This is a fused heart tube showing the bulbus, then the primitive ventricle, primitive atrium, then this part is the sinus venosus, and these are the horn of sinus venosus. So in the horn of sinus venosus we have three parts. Okay, here you can see only two, but we have three parts. Okay, one is for the common cardinal, one is for the umbilical vein, and one is for the vitelline veins. This bulbous part is again divided into again three parts. Okay, bulbous part is again divided into three parts, which are truncus arteriosus, conus cordis, and proximal one-third of the primitive ventricle. Okay, this part is the bulbus, this is the primitive ventricle, primitive atrium, sinus venosus, horn of the sinus venosus. The bulbus is again divided into three parts. One is the truncus arteriosus, one is the conus cordis, third is the primitive ventricle. Okay. Truncus arteriosus will form the outflow tract. These are the outflow tract. So what are the outflow tract? They are the aorta and the pulmonary artery. Okay. Truncus arteriosus will form the outflow tract. Then we have the conus cordis. Then we have the primitive ventricle, proximal one-third of the primitive ventricle. Then we have this part is for the left ventricle in the bulbous part. In the primitive in the primitive ventricle, it will form the right ventricle. Okay, trabeculated part of right ventricle. This is the common atrium. Okay, this is the common atrium. This is the sinus venosus, and the down is the horn of the sinus venosus. Okay. Now we are coming to this model. Okay, this model is visible.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Now in this model we have to tell this is the model of the heart showing the formation of this is the interatrial septum. We are showing the formation of interatrial septum and also some part of the interventricle septum. Okay. So this is a model of heart showing the formation of this is the interatrial septum and this is the interventricular septum. Now we'll study how it is formed. Okay. Now, first of all, what is this blue color structure? This blue color structure, anybody knows this? What is this blue color structure? Anybody know what is the name of this blue color structure from the embryology class? So this structure you have to tell it is the sinoatrial orifice. Sinoatrial orifice guarded by, we have on the right side the right venous valve and on the left side by the left venous valve, valve. So this is the sinoatrial orifice guarded by the right venous valve and the left venous valve, and both of them are joined in the wall of the atrium by a septum known as septum spurium. It is not seen here, but it might be asked in the exam. So first of all you have to tell this blue structure is sinoatrial orifice guarded by the right venous valve and the left venous valve. Is it clear? Is it clear, everyone?
Yes, ma'am.
Now next we are going to come to the interatrial septum development. Okay, so first of all, what is this growing structure? What is this? Anybody can tell me? What is that? Okay. Now concentrate in this one. So in the middle, this middle part, what is this? This is known as AV cushion. This is AV cushion. Okay. Then in the upper part, this thing, okay, this is septum primum. Septum primum. This is AV cushion. The down in the middle, this is the AV cushion. This is septum primum. So septum primum has the tendency to grow downwards toward the AV cushion. Before going downward, this is known as ostium primum. Not this white structure, but this whole space is known as ostium primum. Okay. So what is this? This is AV cushion. This is septum primum. This space is known as ostium primum. Is it clear? Everyone, did you understand this much?
Yes, ma'am.
Okay, so
Yes,
this is septum primum. This is AV cushion, and the space is known as ostium primum. And can you see here a septum which is developing just above the sinoatrial orifice? This septum joined the two valves. So this is known as septum spurium. This is septum spurium joining the right and the left venous valve of sinoatrial orifice. Okay. Moreover, what we can see in this embryology model, these four holes are there. What are these? These are the openings of pulmonary vein. At the beginning, there will be one opening. Then the two veins will fuse down. There will be two openings. And then there will be four openings fusing into the atrium. So these are the openings of the pulmonary vein. Okay. What is this? This part is the atrium. Okay, right and left atrium. This part is the right and left ventricle. But how are they divided? They are going to be divided by the septum, right? So this is the ingrowth of the muscular part of interventricular septum. This is just the beginning of the muscular part of interventricular septum. Interventricular septum has two parts, membranous and muscular. So this is the muscular part. So if you get this model, you have to say this is a model of the heart showing the development of the interatrial septum and the beginning of muscular part of interventricular septum. In the interatrial septum, we can see the AV cushion, the septum primum, the space ostium primum. Okay. And also we can see the sinoatrial orifice with the right venous valve and the left venous valve, which is joined in the wall of the atrium by septum spurium. Is it clear? This model is clear? Everyone?
Yes,
Kindly
ma'am.
respond. Okay. If it is not clear, you tell me again, I am going to explain. Now we come to this. After this, we will see what. Now what happens? This septum, right? This septum primum, there is your apoptosis of cells in the upper part. Okay. So what happened? It will join the AV cushion. It will come down and it will break down. That septum primum will break down and it will join the AV cushion. Okay. And this now secondary opening is known as ostium secundum. Okay. It is known as ostium secundum. Earlier what happened? There was septum primum, AV cushion, and the ostium primum, only one space, ostium primum. Then what happened in next step? There will be apoptosis of cells in the top part of the septum primum, and that septum primum will break down to the AV cushion. It will join the AV cushion, and there will be a formation of secondary opening, and this opening is known as ostium secundum. This secondary opening is known as ostium secundum. Okay, understood? Okay.
Yes.
Now, after formation of ostium secundum, there is again one formation of small septum here. Okay, this is known as septum secundum. Very, very important. Why? Because this septum secundum will grow downwards and like a flap, it will not fuse, but it will just like a flap, it will join the septum primum. Why it will join the septum primum like a flap? Because in the initial stage, the pressure, okay, the pressure in this chamber is high. So it will push the flap of the septum secundum towards the primum. Okay. Then, and one more thing, this septum, you can see here in this model, this septum secundum is not growing. Okay, in one of the model, I didn't get it in the department, but one more model is there where they will show this septum secundum is growing down. Okay, so what is the function of the septum secundum? It is guiding the blood flow. Okay, it is guiding the blood flow from the right atrium to the left. Okay, it is guiding the blood flow from here to here. So when this septum is going to act as a flap and join the septum primum, this is known as this blood flow, the space through which the blood is flowing will be known as, anybody can tell me what it is known? Very common. What it is known? It will be known as foramen ovale. Foramen ovale. Okay. The blood flowing from the right atrium to the left atrium. Okay, from here that portion will be known as foramen ovale. And when after the childbirth, after first cry, okay, this flap will close this, and this foramen will be transformed into fossa ovale. Okay, foramen will be transformed to fossa ovale. Till now clear, or any doubts?
No, ma'am.
Or should I repeat it again? Should I repeat it?
Yes, ma'am.
Okay. See, just see, because it is important. Okay. First, what was there? First there was, what is this? This is septum primum. Septum primum. This is AV cushion. This is ostium primum. Okay. Second stage, what there will be? There will be apoptosis of the cells in the septum primum. It will come down and join the AV cushion. And this ostium secondary to the ostium primum is ostium secundum. Simultaneously, one more septum will develop here. This is known as septum secundum. What is the function of the septum secundum? As the pressure in the right atrium increases, okay, this septum secundum will behave like a flap and join the septum primum, and the ostium secundum will be known as foramen ovale. After the childbirth, after the first cry, okay, what will happen? This foramen will be transformed into fossa ovale. Okay, so if question is asked in exam, who forms the fossa ovale? So your answer will be septum primum is forming the fossa ovale. And one more structure is there. We will study in next class in interior of the heart. Limbus fossa ovale or annulus fossa ovale. So annulus fossa ovale is a elevation around the fossa ovale which is formed by septum secundum. So question if comes, fossa ovale is formed by septum primum, limbus fossa ovale is formed by septum secundum. Okay. Okay. Now can you see this? Kindly respond. You can see this, right? So this is interventricular
Yes,
septum.
sir.
This is the muscular part of interventricular septum. Okay. It is encroaching towards the AV cushion. Okay. Now what happens? We have done regarding the formation of interatrial septum and about the fate of the venous valve. Okay. Most important question asked in exam. What are the fate of the venous valve? So this is the right venous valve. This is the left venous valve and they are both connected to the upper part of the valve by septum spurium. So what happens? The fate is that the left venous valve will fuse with the septum secundum. Okay. The left venous valve will be fused with the septum secundum and will be absorbed in the right atrium. But the right venous valve, this is more important, the right venous valve, okay, it has fate. This right venous valve is divided by two bands, okay, two bands, superior limbic band and inferior limbic band. You can see here, I am just telling, superior limbic band and inferior limbic band. Okay, the part which is above the superior limbic band, it will form the crista terminalis. Crista terminalis. And crista terminalis is the division or the boundary which separates the rough part from the smooth part of the right atrium. Okay. So the part above the superior limbic band will form crista terminalis. Part below the superior limbic band will form the wall of the inferior vena cava and part below the inferior limbic band will form the wall of the coronary sinus. Tomorrow in dissection I will show you by drawing it what I am meaning it. Okay, you will not understand here. But if they are asked what is the fate of right venous valve and what is the fate of left venous valve will join the septum secundum and fuse in the right atrium and the right venous valve will form crista terminalis, wall of the inferior vena cava and wall of the coronary sinus. Okay. Now coming to the interventricular septum formation. Okay. See, this is the folded looping of the heart. Okay. First of all, you have to understand a looping. Then I will go to the interventricular. You know, initially what was there? Initially, there was a fused heart tube. Okay, two tubes are there. They fuse together to form a heart tube. Then there will be looping. Looping means the heart tube is going to bend so that it is accommodated in the pericardial cavity. Okay. First there will be U-shaped bending. Then there will be S-shaped bending. U-shaped loop. Second there will be S-shaped loop. And as the fate of the loop, okay, the structure of that one tube will become like this, compact like this. Okay. And what will happen? What I am showing here is that this loop, it has bended. Okay. It has become compact. And we have cut that compact structure with a plane. Are you getting it? Okay. First of all, there is a heart tube. There is looping of the heart tube. It will loop to U shape, then S shape, then it will become a compact structure like this. It will become a compact structure like this. And what we are doing, we are cutting this compact structure this way with a plane, and we are showing the interior of the heart. So this is that model, understood? So now what happened after the looping? Normally in this part we had the bulbous cordis, we had the primitive ventricle, we had the primitive atrium, we had the sinus venosus, and we had the horns. Okay. After the looping, what happened? This part, this primitive atrium, it comes backwards. Okay. So this part is this part. Okay. This primitive atrium is coming backwards. So this is the primitive atrium. And this ventricle is this part. Okay, these are the ventricles. And this is the bulbus. So this is the bulbus. Okay, this is the bulbus with the outflow tracts. And the sinus venosus is at the back side. Okay, so you have to just imagine like that. This is the fused heart tube. There was looping. First there was U-shaped looping, then there was S-shaped looping, and after that it has become compact. And this primitive atrium, this part, primitive atrium has come backside. Okay. This part is the primitive ventricle. It has come front. Okay. This is the bulbus. This long thing is the bulbus. So this is the bulbus region. Okay. With the outflow tract. So what I was telling, this is a fused heart tube. There is looping. Okay. There will be looping. It will become a compact structure like this. Okay. This part was the atrium. That atrium is coming backside. This part was the ventricle. Ventricle is coming front. This is the bulbus. Bulbus is this region. Okay. This outflow tract. This is the bulbus. Okay. And this sinus venosus is coming backside. Atrium के पीछे था ना, नीचे था. So this will come backside. So this compact structure, this tube is converted to this compact structure, and we are cutting that compact structure. Okay, and we are getting this interior. Okay, this interior. So if now I ask what are these? What are these? These things are ventricle. So this is the, you see, this is backside, there is atrium, front it is ventricle, and both are connected by a hole. So this is what orifice? Atrioventricular orifice. This is atrioventricular orifice. Okay. So if this model comes, you have to tell that this is the heart after the cardiac looping has occurred. Okay. And in this model, we can see the ventricles. These are the ventricles. This is the bulbus cordis. This is the outflow tract. This is the back side. This is the right and left atrium. And this hole is the atrioventricular orifice, because it is joining the back side of the atrium with the ventricle. So it is atrioventricular orifice. Now what happens? For the interventricular septum, why it is important for the formation of interventricular septum? What happens? From this part, this wall of the ventricle, ingrowth occurs like this. You can see my fingers, right? So like this wall grows. Okay. Ingrowth occurs like this, and that ingrowth is known as the muscular part of the interventricular septum. That is the muscular part, because these are the muscular layers. So there is ingrowth occurring here like this. So it is known as the muscular part of the interventricular septum. Secondly, this AV cushion, okay, this AV cushion is also known as septum intermedium. Okay, in some books it is mentioned septum intermedium. So some cells from the AV cushion comes downward, okay, towards the muscular part. This is the muscular part of the interventricular septum. Some cells of the AV cushion comes downward. Then in this bulbar region, in this bulbus cordis, there are formation of bulbar ridges. Okay, there are formation of bulbar ridges. You can see here, but from this part there will be outgrowth like this. Okay, right and left bulbar ridges. Right and left bulbar ridges. And in the upper part there will be formation of spiral septum. Okay, did you know the term spiral septum in the embryology class? Sir has taught. Did sir teach
Yes,
you?
ma'am.
Did sir teach you spiral septum? So, what is the function of the spiral septum? It is going to divide the outflow tract. Okay, we are going to have aorta and we are going to have pulmonary artery, which is again going to divide into right and left pulmonary artery. So that tract is divided by a septum known as spiral septum. Okay, and that is developed in this region, conotruncal region. Okay, and in this part, in the conus part, we are going to develop two bulges, which is known as right bulbar ridge and left bulbar ridge. They are going to fuse along with the fusion of the endocardial cushion. The right and left bulbar ridge will fuse along with the endocardial cushion, along with the muscular part of the interventricular septum, and all these three constituents are going to form the interventricular septum. So, if you are asked that what are the constituents of interventricular septum, you will say muscular part and membranous part. So, muscular part is coming from the walls of the ventricle, right? Like this outgrowth is coming, that is clear. Membranous part is constituted by some cells of the endocardial cushion, some cells from the bulbar ridges. Okay, so that membranous part is formed by some cells from the bulbar ridge, some cells from the endocardial cushion, and they both will combine and form the membranous part of interventricular septum. And this part, which is coming from the wall of the ventricles, are known as muscular part. So both muscular and membranous part will form the interventricular septum. Is it clear or confusing? Did you understand? Regarding the interventricular septum, did you understand?
Yeah, ma'am.
Interventricular septum constituents are two constituents. One is the muscular part and one is the membranous part. Muscular part is very easy. It is coming from the wall, muscular wall of the ventricle as an outgrowth. Okay, this is the muscular part. There, see, my two fingers are joining. This is the muscular part. Here it is forming the muscular part. Membranous part is formed by some cells of the AV cushion, which is also known as the septum intermedium. Then there will be two ridges here. You can see here, there will be two ridges here, right and left bulbar ridge. They will join like this, encroach towards the AV cushion. So some cells from the bulbar ridge, some cells from the AV cushion, that is the septum intermedium. These two will constitute the membranous part. And all these three constituents, right and left bulbar ridge here, the AV cushion here, and the muscular part like that, they will form a membrane which is known as the interventricular septum. Interventricular septum. So interventricular septum is little bit complex. You have to tell there is two parts, muscular part and membranous part. Muscular part are the ingrowth from the muscular wall of the ventricle coming towards each other. So this is the muscular part. If ma'am shows you, what is this part, if in exam if you ask what is this part, you have to tell this is the muscular part of interventricular septum. Okay, now very important is that when it will join the AV cushion and when it is going to completely form the interventricular septum, this interatrial and interventricular septum are not going to line in a straight vertical line. As you can see here, these are in straight vertical line, but actually it is not going to lie in straight vertical line. This interventricular septum will lie little bit right like that, and interatrial septum will lie little bit left like this. Okay, the direction of this will be not straight. This septum are not going to be straight. Okay. So if you get a if in exam you are asked to explain the formation of interventricular septum, again I am repeating because it is little bit confusing. Interventricular septum is formed by two constituents. One is the muscular part. Okay, this is the muscular part coming from the wall of the ventricles, muscular part, and a part called membranous part. You can see here, membranous part is formed by some cells of the AV cushion, which is AV cushion is also known as septum intermedium. Some cells from the bulbar ridge. I told some ridge will be developing here in this region, right and left bulbar ridge. Some cells from the bulbar ridge, some cells from the septum intermedium or AV cushion together will form the membranous part of interventricular septum, and it will join the muscular part coming from below upwards and form the complete interventricular septum, which is not going to lie in the same vertical plane. It is going to lie little bit right towards the right. Okay. Now you can see these two things. Okay. What are these? These are also AV cushion, means AV cushion which is encroaching towards the septum intermedium, and this is known as the atrioventricular canal. So we have right AV canal, we have left AV canal. Okay, this is atrium, this is ventricle, and this joining is known as atrioventricular canal. We have two AV canals, right AV canal and left AV canal. And how right and left AV canals are formed? There will be if you cut this tube in a by a horizontal plane. Okay, if you cut this tube by a horizontal plane, then you will see there is a one canal. Okay, first you will see a single canal, and there will be outgrowth from the dorsal and the ventral part. That outgrowth will join encroach towards each other, and that one canal will be converted into two canals. So that in that way we'll have right and left AV canals. Okay, now coming to the outflow thing. We have here, this is the bulbus cordis. Bulbus cordis is divided into three parts. I told the upper part is the truncus arteriosus, then conus cordis, then we have the proximal 1/3 for the right ventricle. Okay, now what happens in this bulbous region? Septum develops, spiral septum develops, which divides the outflow tracts. So the pulmonary artery, so that why division is important, so that the pulmonary artery will drain into the right ventricle and the aorta will drain into the left ventricle. So if there is some problem in the formation of the spiral septum, abnormality develops, that is known as transposition of great vessels. Transposition of great vessels happens. What happened that time? That spiral septum formation is there is some problem in the spiral septum formation. Normally what happens, the pulmonary artery drains into the right ventricle and the aorta drains into the left ventricle. But if there is transposition of great vessels, this whole things change. Then what it will happen? Pulmonary artery will drain into the left and aorta will drain into the right. So the formation of spiral septum is very important in the formation of the outflow tract. Okay, so one more thing is there. If question is asked, do you know about neural crest cells? Do you know about neural crest cells?
No, ma'am.
So okay, during development only, just for now you remember, neural crest cells also contribute to the formation of the conotruncal septum or the spiral septum. So if in exam you are asked in what part of the heart the neural crest cells contribute, or does neural crest cells contribute in the formation of heart? So you have to tell yes, it contributes in the formation of conotruncal septum. Okay. Also, if there is anterior displacement of the conotruncal septum, what abnormality results is tetralogy of Fallot. Okay. In tetralogy of Fallot, you have four things. I will teach you tomorrow separately in a board. Okay, just for information I am telling you, if there is anterior displacement of the conotruncal septum, so what abnormality might develop? Tetralogy of Fallot. And why this spiral septum is important? To divide the outflow tract so that the pulmonary artery drains into the right ventricle, the aorta drains into the left ventricle. Any problem in the formation of spiral septum will result in the abnormality known as transposition of great vessels. Okay. So let us revise again. Okay, just without any model I am going to revise. First you have the formation of heart tube. There are two heart tube. Okay, two heart tube will fuse. They will form one heart tube. It occurs in the beginning of the at the end, like at the end of third week and beginning of the fourth week. Okay, two heart tube will fuse and form a single heart tube. Okay, now from where does this heart tube comes? First of all, the certain cells will migrate from the epiblast to the splanchnopleural mesoderm. You have to remember mesoderm. Mesoderm, you have three mesoderm, right? Paraxial, intermediate and lateral plate mesoderm. So lateral plate mesoderm will split. The upper part is known as somatopleuric. The lower part is known as splanchnopleural. And in between this, there is intraembryonic Shillong, which is going to form the pericardial cavity. Now, from this splanchnopleural mesoderm, certain signals will come, which will result in the formation of blood island. Okay, blood island. That blood island is in the form of horseshoe. Tomorrow I am going to explain in the blackboard in this section that blood island is in the form of horseshoe. Okay, and that blood island there will be vasculogenesis and angiogenesis. This will result in the formation of two endothelial heart tubes. From that time I am telling about heart tubes. So these are two endothelial heart tubes. These two endothelial heart tubes will fuse, okay, and it will form a single heart tube. Two endothelial heart tube will fuse and it will form a single heart tube. Now, in the single heart tube, there will be divisions. Okay, there will be divisions. This is the outflow, and here also we have the two venous sinuses. So this part, this long part, is known as the bulbous cordis. This is known as the primitive ventricle. Okay, this is known as the primitive atrium. This combined part is the sinus venosus, and these are the horn of the sinus venosus. Okay, first there will be two heart tube. They will fuse. They will form one heart tube. There will be dilatations in this heart tube. First dilatation is the bulbous cordis. Then you have the primitive ventricle. Then you have the primitive atrium. Then you have the sinus venosus, and these are the horn of the sinus venosus. This is the primitive atrium. So the interatrial septum is forming in between. Okay. Okay, the interatrial septum is forming in between. Okay. Now, after the formation of this heart tube and the formation of the dilatations, there will be looping. Okay. Why there will be looping? Because this whole part, this heart tube is in a cavity, and this is known as pericardial cavity, which is formed by the intraembryonic coelom. Okay, intraembryonic cavity between the somato and the splanchnopleural mesoderm. So it has to accommodate this tube. So there will be looping. पहले ये सीधा था, straight. Then there will be first of all a bend. Okay, that is the U-shaped looping. Then there will be S-shaped looping, and ultimately after the looping, we are going to get a structure like this. Okay, it will become a compact structure. So in this part, this was the primitive ventricle, this part was the primitive atrium. So after the looping, this atrium will come backside. Okay, the atrium will come backside. So this back portion are the atrium. This primitive ventricle will come front. So this part is the ventricles. This is the bulbar region, bulbous cordis. So this is the bulbous cordis. Okay, and this foramen or this orifice, which is connecting the ventricles with the atrium, is known as atrioventricular orifice. Atrioventricular orifice. Okay. Also in the bulbous cordis, it is divided into three parts. The upper part is known as truncus arteriosus. This division in the bulbous cordis will be divided into three parts only after the cardiac looping occurs. Okay, not in this part, only after the cardiac looping occurs. So this upper part is known as truncus arteriosus. The middle part is known as the conus cordis, and the lower part is known as proximal 1/3 of the ventricles. Okay, trabeculated part of ventricle. Now we are coming to the formation of the interatrial. I am repeating again, okay, because it is very confusing. So interatrial septum. Interatrial septum, how it develops? Okay, can you tell me how this atrium develops? How this atrium develops? Anybody? Can anybody tell me how the atrium develops?
From primary auricle.
Huh? Kindly repeat. How the atrium develops? So, atrium will develop from the heart tube, right? I have told just now that this is the primitive ventricle, this is the primitive atrium. So, primitive atrium is going to develop from this part, atrium is going to develop from this part, right? Primitive atrium. Okay, this is the primitive atrium. Now, what happens? We have two parts in the atrium. The upper part is the rough part, the lower part is the smooth part. Okay, so from where the rough part develops and from where the smooth part develops? Anyway, can anyone tell me? From where the rough part develops and from where the smooth part develops? So the smooth part develops from the sinus venerum. The smooth part develops from the sinus venerum. These are the sinus venosus. Okay. After looping, it will come backside. Okay, it will come backside, and it is going to get incorporated in the walls of the primitive atrium. So this incorporation of the horn of the sinus venosus into the primitive atrium is going to form the smooth part, and the already primitive atrium is going to form the rough part of the atrium. Okay, leave it. Now come to the interatrial septum. Again we are repeating. So if this model is shown, you have to say that this is a embryology model of heart showing the development of interatrial septum, some parts of the interventricular septum, and the right and left horn, right and left pulp of sinus venosus. Okay, so in here, first of all, now can anyone respond me? What is the septum? I already told from 1 hour I am telling this. What is the septum? This first septum?
Septum primum.
Septum primum. Septum
Primum.
primum. Because first means prime. Septum primum. This is the AV cushion. Okay, this is the AV cushion. So septum primum has the tendency to come towards the AV cushion. Don't tell anything about this dot. Okay, it is little bit mistake. Now, the space between the septum primum and the AV cushion is known as what? Can anybody tell me?
Ostium.
Yes,
Ostium primum.
primum. Ostium primum. The space between septum primum and AV cushion is known as ostium primum. Okay. Now, if they are going to ask what is this, first of all, this we will say this is sinoatrial orifice guarded by right venous valve and left venous valve, which are joined in the upper wall by a septum known as septum spurium. So septum spurium joins the right venous valve with the left venous valve, and this orifice is known as sinoatrial orifice. Okay, now in the second stage, what happens? There will be apoptosis of cells in the upper part of the septum primum. It will break down and join the AV cushion. Okay, the septum primum, there will be apoptosis of cells in the upper part of the septum, and it will break down and it will join the AV cushion. Okay, now this space, secondary space, what is this space called? What is this space called now?
Ostium secundum.
Yes, this is known as ostium secundum. This is known as ostium secundum. Simultaneously, there will be another septum formation here. This septum is known as septum secundum. This
Second,
septum is known as septum secundum. In one more model, what will happen? It is not here now. This septum secundum will grow downwards and will try to touch the septum primum. Okay, this septum secundum will grow downwards and try to touch, it will not join, it will just touch the septum primum. Why? Because initially there will be the increased pressure in right atrium. So this pressure will push the septum secundum like a flag to join the septum primum. And then what will happen to this ostium secundum? What it is called? Tell me. When the septum secundum will join the septum primum like a flap, this ostium secundum will be called, anyone?
Foramen oval.
Foramen oval. Yes, this ostium secundum will be called foramen oval. Then the blood will flow from the right atrium to the left atrium through the foramen oval. Okay. Now, after birth, what will happen? There will be closure of this foramen oval, and the foramen oval will be converted to what? Can anybody tell me? After birth, foramen oval?
Fossa oval.
fossa oval.
Fossa oval. There will be just a depression in this region. You can't see any foramen here after birth. If you dissect the heart from a child, just after birth, you will just see a fossa, and that is known as fossa oval. And there is an elevation around that fossa oval, which is known as limbus fossa oval. So, can you tell me what constitutes the fossa oval? Anyone? What constitutes the fossa oval?
Septum
Septum
secundum.
primum.
No, not secundum. Fossa oval is constituted by septum primum. Why? Because this big septum is septum primum. This is what is going to be constituting the upper part of the septum primum is going to constitute the fossa oval. So fossa oval is formed by septum primum, and the limbus fossa oval, that is the elevation around the fossa oval, is formed by, anyone? Limbus.
Septum secundum.
Septum secundum.
Yes. So kindly note these two questions. These questions are going to be asked in your exam again and again and again. These are the favorite questions. Every time, every year, same questions are repeated. So I am just telling you from the exam point of view. Okay, what are the questions asked? Fossa oval is formed by, tell me, fossa oval is formed by
Septum primum.
Septum primum.
primum. Limbus fossa oval is formed by
Septum secundum.
yes,
Septum secundum.
Okay. Now we are coming to the, what is this? Anybody? What is this orifice? What is this orifice?
Sinoatrial orifice.
Very good. This is known as sinoatrial orifice. And what are these valves guarding the sinoatrial orifice?
Right and left venous
Septum
valve.
left.
Right and left venous valve. They are connected to the upper part of the wall of the atrium by a septum. What is that septum known?
Septum spurium.
Septum
Septum
spurium.
spurium. Don't confuse septum spurium with septum secundum. Septum spurium is different. Septum secundum is different. Septum primum is different. Three septums. Okay. So septum spurium is connecting the right and left venous valve of the sinoatrial orifice. Now, what is the fate of the left, which is this side? which is near the septum secundum. What is the fate of the left venous valve? Anybody? What is the fate
Fused
of?
with second
Yes, yes. Tell me again. What is
Fuse.
it? It fuses with the septum secundum.
septum secundum.
It fuses with the septum secundum. Since this left venous valve is nearer to the septum secundum, it fuses with the septum secundum and gets incorporated in the right atrium. What is the fate of the right venous valve? Can anybody tell me? What is the fate of the right venous valve? These are the questions asked in exam. What is the fate of right venous valve? Can anybody tell me? Anyone?
Divide.
Okay. For now, you just remember the fate of right venous valve. Three things you have to remember. Number one is crista terminalis. Number two is wall of inferior vena cava. And number three is wall of coronary sinus. Okay. The fate of right venous valve is crista terminalis, wall of inferior vena cava and wall of coronary sinus. Crista terminalis divides the smooth part from the rough part of the right atrium. Okay, crista terminalis is the boundary between the smooth and the rough part of the right atrium. So the fate of the right venous valves are three things just now I have told. Tell me, what is that? The fate of right venous valve.
Crista ampularis, wall.
Not ampularis, crista terminalis, crista terminalis. Okay, crista terminalis,
Crista terminalis.
wall of inferior vena cava and wall
Wall
of
of
coronary
coronary
sinus.
sinus.
Yeah,
Wall
very
of
good,
coronary
very good.
sinus.
Okay, okay. Now, can anybody tell me what are these canals? This is atrium. This is ventricle. What are these canal? What are these two canals? This is
Atrioventricular
AV
Right
canal.
canal.
and left.
very good. It is atrioventricular canal. It is atrioventricular canal. Very good. Now, can anybody tell me what is this? Coming from the muscular wall. What is
Muscular
this?
part of interventricular.
Very good. This is the muscular part of interventricular septum. Now, can anybody tell me how many parts are there in interventricular septum?
Two
Two.
parts.
Muscular and
Membrane.
yes, muscular and membranous. Okay, muscular part is coming from the muscular wall of the ventricle. Right. Now, membranous part. Membranous part, I have told two things constitute the membranous part. What are they? Can you tell me? This is the AV cushion. So, some cells from the AV cushion is also known as septum intermedium. Okay, so don't get confused. Some cells from the AV cushion, and there will be two ridges here. Two ridges here. Since it is known as bulbous cordis, the ridges are known as the ridges.
Bulbar ridge.
Yes,
Bulbar.
very good, very good. The
Bulbous
ridges are
ridges.
known as bulbar ridges. So these two bulbar ridges, right and left bulbar ridges, which is not seen here. Just imagine there are two ridges, right and left bulbar ridges. Some cells from the AV cushion. These three things will constitute the formation of what? What?
Membranous part.
Very good. These three
Membranous
things
part.
will constitute the formation of membranous part of interventricular septum. So, right and left bulbar ridge, some cells from the AV cushion will constitute the formation of membranous part, and from the muscular wall coming from the ventricle, this will form the muscular part, and all these three will join and form the what? What they will form?
Interventricular.
Inter Yes,
Interventricular septum.
interventricular septum. So interventricular septum has two parts, muscular part and membranous part. Muscular part is coming from the muscular wall of the ventricles. Then the membranous part is constituted by certain cells of the AV cushion and the bulbar ridge, right and left bulbar ridge. They are constituting the membranous part. Well, now you tell me, what is this orifice? This is backside is the atrium.
Atrioventricular.
Yes, this is front side.
Atrioventricular bulb.
This front side is the ventricle, back side is the atrium. Connecting these two will be the atrioventricular orifice. Understood? What is this part? What is this part called? Can anybody tell me? What is this part called? This part is
Bulbous cordis.
yes,
Bulbous
this part
cordis.
is
Bulbous cordis.
bulbous cordis. Now bulbous cordis is divided into three parts: upper part, middle part, and lower part. So the upper part is forming the outflow. Yeah, the upper part is forming the outflow tract. And what is the name of the upper part?
Fungus arteriosus.
Truncus.
Truncus arteriosus. What is the name of the middle part?
Conus cordis.
Conus cordis.
Cornish cord.
Yeah, what is the name of the lower part, third part? What is this?
Proximal
Proximal one third of
Proximal
ventricle.
1/3 of ventricle.
Proximal one third of ventricle, trabeculated part. Very good. Now, in the upper part, truncus part, there is a development of a spiral septum. Okay, what is the function of the spiral septum? It is going to divide. It is going to divide the outflow
The
tract
outflow.
into. Tell me, it is going to divide the outflow tract into.
Pulmonary into the right.
Aorta and pulmonary artery.
Pulmonary.
Yes. Now, can anybody tell me pulmonary artery is opening where?
Right ventricle.
Right ventricle.
Okay.
Right ventricle.
Pulmonary artery is opening in the right ventricle,
Ventricle.
and aorta is opening in the
Left ventricle.
left
Left
ventricle.
Left ventricle.
So, if there is any problem in the formation of spiral septum, what abnormality it is called? What is the
Transposition of great.
yeah, so just remember this pulmonary artery. Yes, very good, very good. Pulmonary artery and aorta are the great vessels. So any abnormality in the great vessels, transposition means exchange, displacement. So there will be transposition of great vessels. What happens in transposition of great vessels?
Pulmonary will drain.
Yes, normally the pulmonary artery opens in the right ventricle, but in transposition the pulmonary artery will open in the left ventricle.
Left ventricle.
Yes, it will be ulta. It will be ulta to the normal thing. So any problem in the spiral septum will lead to transposition of great vessels. Okay, now this whole septum, okay, this whole septum is known as spiral septum and the bulbar which together this whole septum is known as conotruncal septum. This conotruncal septum is it constituted by some other cells? Embryologically, I have mentioned it.
Neural crystal.
Neural crystals, yes. So these questions also comes in MCQ. Very important. Every time examiner will ask, any external will ask. Neural crystals constitutes also in the formation of conotruncal or spiral septum. Okay. Now, since I have told you about the interatrial septum, now tell me, if this interatrial septum is not formed, what abnormalities form? Any defect? What is the name of the defect? If interatrial septum is not completely formed, what is the abnormality of the defect? In clinical importance, you have to write this. So it is known as atrial septal defect, ASD. ASD. Atrial septal defect. Did you get it? If there is any abnormality in the formation of interatrial septum, a defect develops which is known as atrial septal defect, ASD. If any problem in the formation of the interventricular septum, there is a defect developed. What is the defect called? The short form is VSD. What is that? Anybody?
Ventricular septal
Ventricular
defect.
septal defect.
Yes. So defect in the interatrial septum is known as atrial septal defect. The defect in the ventricular septum is known as what it is known as? What is it? Just now I have told defect in the interventricular septum.
Ventricular septal defect.
Yes, VSD. So if the question comes in exam, that write about the development of interatrial septum. First of all, you will write the development, okay, whatever I have taught, septum, primum, secundum. After that, in clinical importance, you have to write about atrial septal defect. Okay, if a question comes about the development of the interventricular septum, then you have to write in clinical importance ventricular septal defect, VSD. Now we are coming to a very important abnormality which is known as tetralogy of Fallot, TOF. Anybody knows about what is tetralogy of Fallot? Do you know what is tetralogy of Fallot? Anybody? Can anyone tell me any of the abnormality? One abnormality in tetralogy of Fallot. There are 4 abnormalities. Can anybody tell me one abnormality in the tetralogy of Fallot? Anyone? Any one? Yeah.
Ventricular septal defect.
Yes. Very good. Ventricular septal.
Pulmonary stenosis.
Yes. Okay. Okay. Fine. Ventricular septal defect. So what happens in TOF? The short form is tetralogy of Fallot. What happens in TOF? What happens in TOF? So there are four things in tetralogy of Fallot. Okay, there are 4 things in tetralogy of Fallot. And why there is tetralogy of Fallot? Why it occurs? Can anybody tell me? I have told in one just now. Like during explaining the conotruncal septum. Why tetralogy of Fallot occurs? I have told while explaining conotruncal septum, if there is anterior displacement of the conotruncal septum or abnormality develops, that is known as tetralogy of Fallot. So what happens in tetralogy of Fallot? First and foremost, what are you going to say? Are you going to say VSD? Are you going to say pulmonary stenosis? What is the first and foremost thing occurs? Do you know? Anyone? In tetralogy of Fallot, there is a sequelae. Okay, you know what is the first abnormality in tetralogy of Fallot? Do you know? Anyone? It is an open question. Anybody can answer. What is the first abnormality in tetralogy of Fallot? Anyone?
Pulmonary stenosis.
Yes. So, there is pulmonary stenosis. What is pulmonary stenosis? So what happens? Since I told there is anterior displacement of the conotruncal septum. Conotruncal septum is going to divide the aorta and pulmonary artery. If there is anterior displacement of conotruncal septum, the foramen, just imagine, this is the foramen of pulmonary artery. Okay, this is the foramen of pulmonary artery and this is the conotruncal septum dividing it from aorta. So if there is anterior displacement, अगर anteriorly displace हो गया, तो ये जो foramen है of pulmonary artery will constrict and it will become stenosed and that is known as pulmonary stenosis. Pulmonary stenosis अगर हो गया, तो pulmonary artery is opening into which ventricle? Tell me, pulmonary artery is opening into which ventricle? Right ventricle. Pulmonary stenosis हो जाने से right ventricular pressure will increase or decrease?
Increase.
Very good. So right ventricular pressure will increase. Okay. Pulmonary stenosis हो गया, right ventricular pressure increase हो गया. There will be development of a defect in the interventricular septum that time. So what is that called? Pulmonary stenosis. There will be because of the increased right ventricular pressure, there will be also a defect in the interventricular septum and that defect is known as VSD, ventricular septal defect. VSD is a large, you will have a large VSD in the ventricular, in the TOF. Okay, so there will be development of VSD. Third, there will be overriding of aorta. Do you know what is overriding of aorta?
No, ma'am.
What is overriding? Anybody? Overriding of aorta. So, listen, never confuse overriding of aorta with transposition of great vessels. Transposition of great vessels में क्या होता है? दोनों exchange हो जाता है. Pulmonary artery जो right में खुल रहा था, it will open into left. Aorta will जो left में खुल रहा था, it will open into right. This is totally opposite. But overriding of aorta is that normally aorta open हो रहा है, लेफ्ट वेंट्रिकल में, ओवरराइडिंग में क्या होता है, इट विल कम इन द मिडिल. Okay, it will not open into the right ventricle, but it will be coming into the middle. Are you getting it? Are you getting it?
Yes, ma'am.
So transposition में क्या होता है, aorta will open into the right, pulmonary artery will open into the left, totally opposite. But overriding में क्या होता है, what will happen in the overriding, the opening of the aorta will be displaced in the middle. It will not directly open into the right, it is going to get displaced from the left to the middle, and that displacement is near the VSD. VSD क्या है, वेंट्रिकुलर सेप्टल डिफेक्ट. इधर में होगा वेंट्रिकल, ठीक है, इंटरवेंट्रिकुलर सेप्टम. इधर में अगर इतना बड़ा एक डिफेक्ट हो गया, इट इज सो बिग, द VSD is so big that aorta is opening into the VSD. Are you getting me, or is it confusing?
Yes, ma'am.
Are you getting me, or is it confusing? Should I explain again?
Yes, ma'am.
So क्या होता
Yes,
है?
ma'am.
See, I told you there will be pulmonary stenosis. Pulmonary stenosis क्यों हो रहा है? Because there is anterior displacement of the spiral septum. So the foramen is constricting. There is pulmonary stenosis. Pulmonary stenosis के कारण क्या होता है? Right ventricular pressure is more. Right ventricular pressure इतना ज़्यादा हो गया है that it is creating a very large ventricular septal defect. The ventricular septal defect is so large that the aorta is not opening in the left ventricle, but it is opening in the VSD. Overriding of aorta means the aorta is displaced in the middle and it is opening into the VSD. Are you getting me?
Yes, ma'am.
So overriding of aorta, the aorta is displaced in the middle and is opening into the VSD. And the last criteria of TOF is, since there is increased pressure, there is increased blood in the ventricle, so you will have right ventricular hypertrophy. Okay. The last is RVH, right ventricular hypertrophy. So what are the four things in tetralogy of Fallot? Number 1 is pulmonary stenosis. Number 2 is VSD. Number 3 is overriding of aorta. And number 4 is right ventricular hypertrophy. Okay. Why pulmonary stenosis is occurring? Anyone? I have told many times. Why?
Anterior displacement of
Yes,
spiral.
anterior displacement of. If you can tell this answer, you are going to get honors mark because these are PG level questions. Okay. Anterior displacement of conotruncal septum leading to pulmonary stenosis. Pulmonary stenosis will lead to increased pressure in the right ventricle. There will be development of ventricular septal defect. The ventricular septal defect is so large that the aorta is opening into the ventricular septal defect, and that is known as overriding of aorta. Since there is more blood and more pressure in the right ventricle, so there will be hypertrophy of the right ventricle, and it is known as right ventricular hypertrophy. So tell me, what are the four things in TOF? Anyone?
Pulmonary stenosis,
Yes.
ventricular septal defect,
Yes.
overriding of aorta,
and right ventricle
and
hypertrophy.
right ventricular
Very,
hypertrophy.
very good, very good, very good. So now this is normal question. एक लेवल ऊपर का क्वेश्चन है, ये है tetralogy of Fallot. This is four things. If somebody asks you what is pentalogy of Fallot, what will you tell? Pentalogy of Fallot. Anybody knows that? Pentalogy of Fallot. किसी को पता है क्या है? और एक चीज ऐड हो जाएगा. Anybody knows what is pentalogy of Fallot? Yes or no? Tell me at least that. Yes or no?
No, ma'am.
Okay. So tetralogy में है चार चीज, पेंटालॉजी में है five things, and the fifth one is ASD. Okay. अगर with TOF one more thing is added, that is ASD, it is called pentalogy of Fallot. Understood? ठीक है?
Yes, ma'am.
So if VSD is there, it is TOF.
Yes, ma'am.
अगर ASD भी ऐड हो गया है, then it is known as pentalogy of Fallot. ये तुमको एकदम हाई लेवल का क्वेश्चन है, अगर सब बोल सके तब you will be asked. So everybody is cleared. Okay, tell me, heart is from which layer? Which layer? पूरा
Mesoderm.
Mesoderm का which is here?
Mesoderm.
Splenopleuric mesoderm. Okay, now can anybody tell me?
Splanchnopluric.
Yeah, splanchnopluric mesoderm. Yes, very good. Can anybody tell me what constitutes the fibrous pericardium? Anyone? What constitutes the fibrous pericardium? You know how many parts of pericardium are there? Pericardium का कितना part है heart में? Anybody?
Fibrous and serous.
Yes, very good.
Fibrous and serous.
Serous. Can anybody tell me serous का कितना part है?
2. Parietal and visceral. Parietal and visceral.
Very good. Very nice. Parietal and visceral. तो parietal कहाँ से form होता है? Parietal part of serous pericardium. Parietal.
Somatopleuric mesoderm.
Very nice. Parietal हमेशा याद रखना. Soma means skin. Parietal मतलब periphery. So parietal part of the serous pericardium is formed by somatopleuric mesoderm. Or visceral part is formed by
Splanchnopluric mesoderm.
splanchnopluric also and okay whatever splanchnopluric. Okay ठीक है. Now fibrous pericardium कौन form करता है? Fibrous pericardium कौन form करता है? Who is forming the fibrous pericardium? मेसोडर्म तो बोल दिया तुम लोग ने. स्प्लैंक्नोसोमैटो वो तो सेरस फॉर्म कर रहा है. फाइब्रस कौन फॉर्म करता है? हु इज फॉर्मिंग द फाइब्रस पेरिकार्डियम? एनीबॉडी?
Septum transversum.
Very nice. Very excellent answer. Septum transversum. So fibrous pericardium is formed by septum transversum. Do you know any other structure septum transversum forms? The one who told me the answer. Do you know any other structures formed by septum transversum?
No, ma'am.
Diaphragm. You know what is diaphragm? Diaphragm is formed by septum transversum.
Yes,
So pericardium अगर पूछे तो you will tell there are two parts, fibrous and serous. Fibrous pericardium is formed by septum transversum. Serous pericardium has again two parts, that is a visceral and parietal. Parietal याद रखो, बाकी सब याद आ जाएगा. Parietal means skin, skin मतलब soma, so parietal is formed by somatopleuric mesoderm. Okay, so the heart is formed by splanchnic layer of lateral plate mesoderm. Okay, very important. Okay, any doubt? I have ended this session. Any doubt?
No, ma'am.
Did you understand? Did you understand what I have
No,
taught?
ma'am. Thank you.
Did you understand? Did you
Yes,
understand?
ma'am.
So any doubt if you
Yes,
have?
ma'am.
Any doubt if you have? Okay, tomorrow I am going to explain again in this section. If any doubt, I can explain again. Okay, if I am present there, if I am not there, my juniors will be there. So if any doubt, you can ask me. Okay, or you can ask in the group. Okay, so I am going to finish this session. Is it all right? Did you understand?
Yes, ma'am.
Yes, ma'am.
Okay, so
Yes, ma'am.
signing off. Okay, so any doubt you can anyhow ask me in the group or you can ask me in the department. Okay, thank you so much. Thank you for your attention.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.